The oxygen blender is used to deliver an exact FiO2 to our neonatal patients. The purpose of providing an exact FiO2 is to minimize the complications associated with oxygen therapy. The more commonly known conditions are ROP, retinopathy of prematurity, and BPD, which is bronchopulmonary dysplasia. The way that these blenders work, we have a flow meter that's attached, which we will give our liter flow, but to control the FiO2, we will actually adjust the dial. The dial on both of these blenders goes from 21% all the way to 100% with various stopping points in between. So that is how we're able to give a direct FiO2. To use the blender, you have to plug in the cables. We have oxygen and air. We plug them into the wall, and you'll notice that when I plug in one gas source that you're going to hear a high-pitched sound. That is an internal alarm for the blender to make sure or to let the clinician know that either a hose is disconnected or the tanks or gas source needs to be changed. So here is our loud pitch noise. And so if you hear this noise, that means that there's a disconnection or the tanks are empty. In order to turn this off, just plug in the other hose, like so. Once both gas sources are connected, then the blender stops its high-pitched alarm. In order to use your blender, you can still attach a water bottle if necessary, or your Christmas tree attachment if necessary. And you would just connect it to the flow meter like so. So we will say that our patient is on a 2-liter nasal cannula. We adjust our flow meter appropriately. There we go. So we have our 2-liter flow coming through the flow meter. Currently, our patient is receiving 40% oxygen because that is what we have our dial turned on. If we want 21%, we turn it there. Or if we want to go to 100%, then we can go there. So the blender just allows us to give an exact FiO2 to our patients. That's it.